Welcome everyone to the Grand River Hospital Foundation's Grand Rounds, sponsored by Gowling WLG. Gowling WLG is an international, full-service law firm with offices across Canada, the UK, Europe, the Middle East, Asia, and South America. My name is Bryce Craker, and I'm the managing partner of the firm's Waterloo Region office. Our firm is proud to support mental health awareness events. A few years ago, Gowling WLG launched a mental health strategy aimed at improving the well-being of all of its personnel across the firm. Under this strategy, we have implemented a number of programs and initiatives designed to promote mental health and support team members who are dealing with mental health issues. Some of these initiatives include our Minds Matter Mental Health Resources Center, which provides quick and easy access to emergency mental health resources. Minds Beacon is a secure online platform that provides free access to cognitive behavioral therapy. Our mental health mini-sessions provide tips on how to manage anxiety and stress, and our Passport to Wellness and Wellness is Worth It programs encourage everyone to practice better self-care while having a little fun. Gowling WLG is also one of the first major law firms in Canada to have certified mental health first aid providers, including me, who are trained to assist individuals who may be experiencing a decline in their mental well-being or who are in a mental health crisis. As the COVID-19 pandemic continues and many people are still working remotely, it is extremely important to focus on our mental health. All of us should feel that we can speak openly about our struggles, ask for help when we need it, and access the care we require, all without stigma or judgment. I hope you all enjoy and can benefit from today's discussion.
Hi everyone, I'm John Heintzman. I'm the Chief of Psychiatry at Grand River Hospital and a child and adolescent psychiatrist. I've been here since 2002. I'm happy to welcome back Dr. Patel today, who is a previous colleague of mine from our specialized mental health program at Freeport site.
Thank you, Dr. Heintzman. Thank you, John, for having me back here. It's wonderful to be back at Grand River Hospital. Certainly my time here was very memorable, and I really appreciated the mentorship that you provided. The organizational culture here certainly left me with a lot of knowledge and desire to help other organizations in the community and across Canada. And so now, as a psychiatrist, I focus on the occupational health arena, and I'm delighted that you've asked me to come here to talk about this very important matter.
All right, well, we thank Gowling for the opportunity to have this conversation about mental health in the workplace, and it's great to have a content expert like Sujay to come and help us learn. So maybe I'll just start right off, Sujay. Is work healthy for one's mental health?
Yes, that's definitely true. Work is mentally healthy as it provides meaning, structure, healthy socialization opportunities, and can bolster one's self-esteem. But that's if an individual is working in an environment that has a very positive tone from its leaders. A toxic and non-supportive environment can lead to feelings of burnout, or even mental illness, which can lead to something called presenteeism, where an individual is at work and not productive as they usually would be. And in the more severe forms, workplace stress and toxic environments can lead to absenteeism. And this is not only costly for employers, it's also costly for employees.
So the way the environment is organized or structured has a big potential impact.
Absolutely.
Yeah. So what would be some of the key components then of creating a mentally healthy work environment?
So there are a number of things that could contribute to a mentally healthy environment. So the best way to kind of start this discussion is, let's start with the moment an employer and an employee meet. This is usually after a job role has been posted and the CV has been reviewed by the employer. At this stage, it is important to ensure that there's a good mutual fit. The employer should ensure that there are clear role, responsibilities, and expectations provided to the employee, And the employee should satisfy themselves that the role fits with their education, their training, as well as their career goals. Because being in a role where one is either overqualified or underqualified is a recipe for mental strain for the employee, and certainly dissatisfaction from the employer's perspective. Initial on-the-job training is highly recommended. This will help the employer and the employee get aligned with respect to the mission, values, and vision of the company, and will ensure that the employee is familiar with the policies and procedures of the company. And this is the first opportunity they will get to have some glimpses of the organizational culture. This is a good time also to explain to the employee how their role is important and can contribute to the overall success of the organization. This will help with not only engagement but also loyalty, and will help prevent burnout and also help prevent that working in silos effect. As the job gets started, getting an employee's input along the way is important, particularly with big company decisions. This will enhance an employee's engagement and loyalty as well. Then coming into an environment that is positive, as I said, is crucial, if not critical, to ensure good mental well-being in the workplace. Setting such a culture is certainly fostered by the leaders of the organization, but it's important to have regular input from the employees. Relationships, whether it be employer and employee relationships or co-workers relationships, all the relationships should embrace an empathic, non-judgmental, respectful, and inclusive approach. So mental health discussions can happen in a way that's free, open, and safe. With regards to performance, employees should have the opportunity to get feedback in a safe space where they are rewarded for their good work and are provided opportunities for growth and development for areas where they can improve. And finally, prevention and early intervention strategies should be implemented, which I'm sure we'll talk a little bit more about.
Very good. So having really clear guidelines and boundaries and a process right from the start sounds pretty key.
Absolutely.
Yeah. Thank you. Could you provide an example, perhaps, Sujay, of a proactive measure that could be taken to promote employee mental health and wellness?
So one can probably think of a number of specific things that employers can do proactively or from a prevention perspective to promote mental health and wellness. But the most important from my perspective, and what would drive the specific initiatives, is having a forum where employers and employees can speak about their perspectives on mental well-being and can together collaboratively build a culture and milieu that, again, fosters that empathic, non-judgmental, and respectful approach while eliminating mental health stigma and fostering open and honest conversation about mental health. From here, both parties can create mutual goals to achieve any required changes. The goals should be sustainable, and in doing so, both the employer and employee should remain flexible, as goals may change over time, as ideas and perspectives on mental health are ever changing. Finally, there should be a focus on strategies that promote good mental health. These can include wellness activities, such as team building exercises, mental health education, and co-management of work-related stress.
You mentioned burnout in your previous remarks. Could you just talk about maybe how an organization can effectively address employee burnout while still meeting goals and deadlines of the business?
Burnout is a very real issue, and probably more so now than ever. People are working from home and trying to balance their personal life and their home life. And certainly in my practice, burnout has almost infinitely increased. And so to me, burnout are those feelings of stress where individuals are experiencing what I would call early symptoms before a full-blown depression sets in. So they may be struggling with their energy levels, having difficulty sleeping, getting into arguments with their partners at home or children at home or their colleagues at the workplace. The goal here for employers is to reduce the employee's stress levels so that the employee can be optimally productive. And an organization can be effective at this stage by ensuring wellness activities and making sure that those wellness activities are readily and regularly available. They can also help by making sure that open conversations are occurring between employers and supervisors, particularly about workload management and stress levels. And organizations can also help to ensure that there are those early intervention strategies are available. And so simple things, as you said, but again, it takes a very in-tune organization to pay attention to these things. But again, very simple to do and certainly pays significant dividends in the end.
So a less stressed employee is a healthier employee and ultimately, bottom line, a more productive employee.
And that also leads to a healthy work environment as well.
CJ, I imagine that many well-meaning employers nowadays in particular want to put some things in place to help their employees. But are there any common challenges or pitfalls that maybe they should be aware of ahead of time?
Yes, John. So the biggest perceived challenge, I would say, for employers who are trying to promote mental health in their workplace is the cost of such initiatives. In their mind, the focus is on the business and what's going on at the current time. And previously, these strategies and making a focus on mental health in the workplace were costly. But now we're in this day and age where the cost and access to initiatives that promote good mental health in the workplace is quite reasonable. And of course, as I said earlier, a good employee mental health will result in increased worker productivity, which can lead to a more successful business for an employer. Once you get the employer's buy-in that this is a good investment, then the next challenge is getting all the employees on board. And as I said earlier, doing this early, likely in the hiring stages, will certainly be helpful. For the employees, in this day and age, we have also all become a little bit more in tune and accepting about mental health discussions. However, there are always going to be some naysayers who can ruin it for everyone. And this is where I think employers have an opportunity to be mindful in their hiring process and education process, and perhaps either weed those naysayers out or help bring those naysayers to a point of, to a place where they can change their views on mental health and accept that this is an important discussion to have in the workplace. I also feel that employers have to be careful of avoiding the error of implementing more general initiatives across the workplace, because this may not fit with their type of business or their workforce. Using experts is something that I always advocate for, so that individualized and tailored approaches is something that will be helpful for them. So I'll give you an example. So, we have an emergency room department here at Grand River Hospital, and a wellness initiative, such as having meetings at lunchtime and having an opportunity to check in with each other. It may not work in a busy emergency room department where everybody is taking their lunch at various points in time, depending on what's going on in their shift. A more reasonable strategy would be perhaps at the end of a shift having a half an hour debriefing or processing opportunity to talk about the way the shift went and what was good, what was difficult, or even having a simple fun steps challenge, who got the most number of steps during the shift. And so those kind of latter strategies would be more fitting for an emergency room department.
So even the healthcare providers need some attention at wellness in the workplace.
I think that's a really important point, because not only have I said that employers have to kind of model good behavior when it comes to that. But certainly all of us who are in the mental health field, we are the leaders to try and demonstrate what are some good practices and good approaches so that people can learn from us.
It's a good thing to be mindful of. We sometimes spend so much time looking after others that sadly we may neglect to look after ourselves.
And then that happens.
That's a good take-home point for me, Sujay.
Thank you.
Good. You've mentioned stress a couple of times. Are there certain risk factors, like in a workplace, that if you're a part of helping them, that you might kind of watch for and encourage them to try to modify?
Yeah, so John, stress in the workplace, from my perspective, can be dependent on the type of work, the players who are involved, and as well as the state and structure of the organization or company. So when thinking about the company and the situation the company is in, as well as the type of work, some of the issues that arise are limited opportunities for advancement, lack of job security, lack of adequate resources, and of course stressful work, where there are long hours, heavy workloads, where there may be very strict deadlines. When I look at the players, the types of stress that are certainly common are when there are those adversarial relationships, particularly between employees, but also between employees and their supervisors. And these relationships, when there's that disconnect, can certainly lead to interpersonal conflicts, and that's something that we see very commonly. So those are the kind of areas where we see commonly lead to chronic stress in the workplace.
Very good, thank you. Would there be some, well, I get asked this as a child psychiatrist regarding school accommodations. So how about workplace accommodations? I imagine there would be some similarities maybe to what we might try to do for a youth in the classroom?
Yes, I think over the years, certainly in the mental health space, I've seen so many different types of accommodations for individuals who are struggling mentally. And I've noticed a correlation with the more accepting a work environment or an organization is, with the creativity that goes into providing the accommodation. So I guess the first thing to do is, talk about what an accommodation is meant to do. So an accommodation is meant to increase one's productivity when mental limitations exist. An organization should certainly have clear policies and procedures regarding this. Because, in my opinion, accommodations can be lifesavers for both the employer and the employee. So speaking of the limitations, the most common types of mental limitations that we see and that can impact an individual's ability to be productive at work include difficulties with managing stress, so poor stress intolerance, fatigue, memory or concentration problems, and difficulty managing an even keel or a stable mood. So some very common accommodations in the mental health space include providing an employee perhaps with a private, quiet office with a lot of natural lighting. This can help with regulating an individual's mood, helping them, stay in a spot that is limited with respect to stress. Recording devices for meetings can help someone who has problems with focus or memory. And then the provision of modified hours or duties can be helpful for an individual who may be chronically fatigued or have poor stress tolerance. Breaks and flexible hours can assist someone who might be having difficulties with sleep or just are persistently tired because of those sleep problems. And then sick leave. I think sick leave is a very important intervention that employers can provide because some individuals just need some recovery time when they're dealing with stress and depression, and they also might need that time to attend treatments, either treatments with their doctor or treatments with their therapist.
Well, Sujay, you've given us a lot to think about today and some very thoughtful answers. But just before we wrap up, are there any other tools or strategies or resources that maybe employers could use that you just haven't had the chance to talk about today?
I think it's important to talk a little bit about what individuals can do for their work colleagues in terms of recognition. So when you see someone who may be struggling with those things I mentioned, fatigue or emotional difficulties or problems focusing and concentrating, an employee can be very helpful, or a leader can be very helpful by just listening and observing. And what a face can tell you a lot. A face can tell you if someone is sad, someone's angry, someone's anxious, or even tired. Poor grooming and reduced engagement in work activities can stand out very obviously in the workplace. Performance and attendance problems, interpersonal conflicts are easily noticeable. So a collaborative and supportive workplace may actually be the best environment to catch someone who is struggling. So for me, that's an important message I want to get across to employees and employers. Just be observant, be open, listen, observe, and if recognition can happen, then the next things that I'm going to talk about become a lot easier. And so I think there are many tools, strategies, and resources for employers in existence these days. Just a simple online search can provide strategies, tools, and access to experts when it comes to implementing good workplace practices from a mental health perspective. But again, I'm probably repeating myself a few times on this particular item, but the real key for employers is setting that positive culture and engaging their employees in matters of mental well-being. Those that have this, the rest should fall in place easily.
Yeah, so Sujay, thank you very much. It was I could have gone on asking you questions for another half an hour or so, but we really appreciate the time that you've taken to share your knowledge and wisdom, and it's great to see what you've developed since you've left us.
Thank you, and thank you for having me back. And it's been, I'll always feel that connection to Grand River Hospital. My time here was fantastic. I talked about that positive work culture. Grand River, hands down, always focused on that, and certainly my learnings from here is kind of what I try and teach other organizations. So very proud to be back here. Thank you.
Very good. Thank you again.